Hi everyone, my name is Michele Peters. I'm a former caregiver and I'm here to try to help maybe give you some suggestions about a more effective and clinical visit with your doctor. As everybody knows here, this is not a disease that it doesn't affect just one person. It affects both people and sometimes the whole family. So what I have found, just some tips, and I'd like to pass those along, and then Dr. Lederer will give you an idea of what it's like on the other side for a doctor trying to help his patients. In the changing climate of healthcare, I think that doctor visits are probably shrinking a bit, and so you really do need to optimize the time that you have with your doctor. So it's really important to come prepared. I kept a notebook, and we saw several different doctors, so each doctor visit I would date who the doctor was, questions that we had, write down the answers, and sometimes in between visits you'll be talking and something comes up, and I can guarantee when the time comes to go to the doctor's office you're not going to remember what that question was. So we would sometimes write them down and then put them on the sheet for the appropriate doctor that we were going to. Sometimes I think that the patient and the caregiver can become so overwhelmed, so much information, you don't even know what questions to ask, and you're trying desperately to get that information into your brain. I think sometimes a sort of a disinterested third party could be a really good idea. That way both you, the patient, and the caregiver can focus exactly on what the doctor is saying, and you can hope that that third-party patient will help you write down all those answers to your questions. Another idea is, just recording on your phone. Then you can go home, and when you're a little less anxious, a little more time, you can replay that back, and then try to absorb everything that the doctor said, and that conversation is probably going to lead to more questions for the next visit. Another thing is before you leave, I think make sure that the patient and the caregiver understand everything that the doctor has told you, especially when it comes down to any sort of instructions for what may need to be done in the future, if there's testing that needs to be done, procedures maybe that need to be, make sure you understand before you leave, because they're not going to probably get another chance real soon to get that answered. I can't stress enough that you need to be your own advocate. The patient knows what their body is capable of doing, they know how it feels, they know when something's not right. I think sometimes people just don't want to speak up, feel that they don't have the right to speak up, but you need to be your own best advocate. And that's the team approach to the advocacy of a patient and caregiver is really crucial. And that's kind of all that I have written down. Like I said, Dr. Lederer is going to give it to you from the other perspective, and we'd be happy to take questions after Dr. Lederer is done.
Thanks, Michele. Thanks. Hi, everyone. I'm Dave Lederer. I'm a pulmonologist. Can you guys hear me in the back okay? All right. I work in New York, despite having lost the accent, I hope. And my specialty is pulmonary fibrosis. I also work part-time with the foundation here. So I thought for a while about what I should talk about here, and I actually realized that you guys are probably the experts on how you should prepare for your doctor's visit. But I do have a few little things, and I think most of you probably know this. Let me see a show of hands. How many people have shown up to their doctor's office, any doctor's office, and the doctor says, "Oh, we never received your records," right? Or you showed up to see your pulmonary fibrosis doctor, and you say, "Well, they told me they were going to send the CAT scan to you." So some of you. So let me tell you a few things from the provider's perspective that makes the visit helpful, I think, for you and for me. So one is, my office can't track down every piece of paper and every CAT scan. We do try when we can, But I would encourage you, and again, I think many of you know this, to be so proactive about making sure that your records from one place were sent to the other place they need to be. We have a very primitive fax machine based information sharing medical system. Some of the EHRs like Epic will share across centers, but it's still very primitive. So if you confirm that that information is shared, that makes your visit and my visit that much easier, and I get to look at what's going on before you walk in the room. On the other hand, if you bring me this, I want it, I need it, but I need it before the visit, or I can look at it after the visit. But right, I can't go through that stack during the visit. That's precious time. And that comes to the second thing, which is during that precious time, and especially the first visit, which I know most of you have already had, I spend, and some of you have seen me, so if I'm misspeaking, let me know. But what I try to do in the beginning of the visit is hear from you what has happened. And of course, that's what every doctor does. But I initially try to shut up and let you speak. And then often I will, after you're done speaking, push you back in time and have you go back to really the beginning. And my cough started 2 years ago, and I'll say, well, what about 3 years ago? What about 4 years ago on your birthday? Because it might be a memorable time. And then I even go back to your childhood and start asking you questions and work back forward through your childhood health and your job history and when other medical events have happened in your life. So if you put that together in your head, because I know it's actually not. Many people who show up to see me have the story. They know, you know what's been going on with your health. You are living with it. You have lived with it. And you come and you communicate it to me often in very passionate ways and important ways. And as a doctor, I get very helpful information from that. My brain works in a linear chronological way. If I don't get the story from beginning to end, I'm never going to remember it. And I have to dictate your note 3 hours after I see you. So I have to remember the whole thing for 3 hours. Unless you see my chicken scratch on the paper you guys have seen if you've been in my office. So thinking about your own story before you walk in the office, really helpful. Trying to get the records and the CAT scans. I know I sound very administrative and almost scolding in a way right now, and I don't mean to be. But working hard with the radiology center or the pathology center or the doctor's office to make sure the records came over and call my office and say, did you get them? And if not, keep pursuing it. That's so important. It really makes that visit so much more productive with you. I've had visits for the first patient visit, meeting with the patient, and we don't have a CAT scan that I can look at with my own eyes. And it really diminishes the value of that visit. One of the most important parts of that visit really is laying my eyes on the CAT scan images. So having said those things, which I do think many of you know, in the few minutes we have left, I was hoping that we could hear from you, either one, share your wisdom about what you think all of us, and meaning all of us who see doctors, and I see doctors too, need to know or ought to do either before or during the visit, or ask questions about how should I do this or whether I should do this. So are there people who can share a story? Kate has a microphone, so she's going to come over to you. Oh, can we get the mic on? Maybe a little thing on the bottom. Great.
Yeah. There's something called Google Drive. So all my medical records are on Google Drive, and I send it to the doctor. It's also good for sharing and getting a second opinion from somebody else. All you have to do is give the email within Google Drive, and they have it. But you still need to talk to the doctor beforehand, because for me, I come from outside US, and that one visit is very important for me.
Sure, and yeah, whether it's through whatever electronic media, even just emailing to the office staff, depends on the office. Every office has different policies, but we do receive a lot of medical records by email, and that certainly works very, very well. So if you take control, right, and you should have access to your medical records. I know how hard it is to get it sometimes, but if they're in your hands, then that makes it all that much easier. That you can email it if it's scanned in, or or of course send it by mail. Thanks for sharing that.
I'm beginning to think that I need to ask at the beginning of the visit what all's going to happen today, so that I know that, I mean, if there's supposed to be blood work done, that actually blood work is done before we leave, because it is a bit much to get back home and find out, well, we're supposed to have blood work, then you have to go back. So I'm thinking that in some ways, the patients, the caregivers need some kind of a checklist like doctors have about what's going to happen in this visit.
All right, Michelle's perfect segue.
Because I did forget this. I used a spiral notebook, and it was, by chronological order, but the PFF actually has this great tool. It's called Pulmonary Fibrosis Physician Notepad. Yeah, and you can, when I saw this when it first came out, I was like, this is awesome. I am just a really organized kind of person, but I envision, dating it, 3-hole punching it, and putting it in a binder that you can take with you everywhere, because there's a place for notes on the back, and there's all the recommendations, things that are going to do today. So you can say, okay, you're sitting with the doctor, are we going to have blood work today? And then you can check that off, and then before you leave, well, wait a minute, we need to get the blood work done. So these, you can contact the foundation. They come in like, just like a notebook pad, and they can easily send them to you if you'd like. I think it's a really, really great tool for a patient.
And I believe that we have some here. Yeah,
Yep.
So if you want to take one, we're happy to give one to you.
And they were designed for, for healthcare providers, but I think Michelle's absolutely right. There's no reason that you can't, either use it yourself or bring it to the provider for them to use. I think it's a great idea. John?
Yes, I was fortunate enough to see Dr. Lederer and the staff at Columbia. But one of the things, after my first meeting with the entire staff, they gave me 20 pages of things I had to get done. And the one thing I have to say, if you have not gone through that evaluation yet or after your first visit, get everything done in a timely basis. I went into the program with a good friend who treated it like it was going to be his high school exam and said, I'll get everything done at the end. And they can see that for 3 months you have not had one visit, you didn't have your cardio cath or anything. So be timely and take an interest in your own health.
Yeah. And I would maybe add, not necessarily related, we have another, Barbara, do you want to?
As a patient, when you're describing your symptoms or how you're feeling to a doctor, how do you handle a situation where you feel that the doctor is not really listening to you? He's not really attending to what you're saying, and you kind of walk out of the office feeling frustrated. As a patient, how would one handle that situation?
Yeah, so to be honest with you, the way I'm going to answer that is putting myself into my own shoes when I'm a patient, because I'm not just a doctor. I see a doctor. I would get a new doctor. That's number one.
Yeah.
We could make up excuses. It was an off day. The doctor wasn't feeling well. But I don't know that I have a better answer than find someone else. And sometimes it may not be a replacement, right? A lot of people have 2 doctors. A lot of my patients have 2 pulmonologists. They see me and they see someone close to home. So, and I have a lot of patients who, started with one pulmonologist, came to see me, but then decided that their local pulmonologist can be someone else. They didn't want to see the first one. And I have other patients who like seeing that first pulmonologist. So it's, I don't know how to solve that, but it is definitely happens. So, yeah. Do we have time for one more, Kate, or are we?
Oh, yeah.
Okay.
Dr. Lederer, I just have a quick question. GPs and then multi-specialty doctors, you wait outside and then you go in and you get your blood pressure and all of the saturation level, and then you go in the exam room and you wait. How much time, and I think I heard on 60 Minutes or something, that the doctors have with you,
Yeah.
and are you all required to see so many patients in a day? And therefore, we as patients need to go, okay, he just got in at 5 after, I only have this much time.
Right, so that's such a great observation, right, is that on the patient side, how much time do I actually have with my doctor? How long is this appointment scheduled for? How many of you know how long your appointments are scheduled for when you routinely go? You know you have a 5-minute or a 15-minute or a 20-minute? So it's only a few people. I mean, when I go to see my doctor, I have no idea, and sometimes it's 3 minutes, and sometimes it's been 20 minutes, I don't know. Different offices function in different ways, right? So some have a kind of multi-layered system. As you said, you go get your vitals done, and then you're sitting in the room, or maybe then you see a nurse, and then you sit in the room, or the nurse comes into the room and leaves, and then you wait for the doctor. It all varies depending on how many rooms the doctor has, and how they've scheduled their day, and how many ancillary staff they have. So there's no one right answer. I'd say if you're in an interstitial lung disease center, like a pulmonary fibrosis care center or another lung doctor who specializes in ILD, and I've talked to my colleagues about this, we generally budget extra time. None of these visits, with a few exceptions, these visits are long. The first visit for me, you get 60 minutes, and if you need more, you get more. On follow-up visits, I schedule 20 minutes for every follow-up visit, which is pretty generous. You know, like we've all been in the doctor's office when you're in and out in 5 minutes. But it's hard for me to think about a visit with a patient of mine with pulmonary fibrosis who came to me in follow-up where 20 minutes, or when less than 20 minutes was enough. That's uncommon. It happens. But most of the time, there's a lot of separate things. How are you feeling? What has happened? Let's go over the PFTs. Do you need a CAT scan? What about your meds? Do we need to go over your meds, renew your meds, change your meds? I mean, there's a lot of things going on. Oxygen, rehab, should we talk about transplant now? How long is that conversation? That shouldn't just be a 3-minute conversation, right? So, but how do you know? You could ask. You could say, doctor, how long do we have? Really, how long do we have today? There's nothing wrong. I would actually love if patients ask me that. That would be great. Do we have time for one more, or we're done? Okay. Well, Michele and I thank you very, very much. Thank you so much for coming to the summit. I want a big hand for Kate. We have a couple more speakers, but everyone please thank Kate. All right. Thank you, everyone.